here today. It's the same way I'm feeling.
I don't want to hear it.
In fact,
Emma.
I'm worse.
Okay, I don't want to hear it because I was just in here an hour ago when we discharged you and you said you were feeling better. I explained everything to you. I gave you a copy of the paperwork. I told you that there's no reason.
I haven't received any paperwork.
It's on your chart. I gave it to you. I printed out your CT and a copy of your labs.
My back still hurts. My tummy still hurts.
Okay, you said
Did the pain go down
your
a little
stomach was
bit?
better.
Did it go down a little bit?
Yes.
Yes, it did.
Okay, well, you just told me now. You know, I don't like to play games. Like now I'm
I
getting
don't.
upset
I
because
do
I've
not
been
like
kind
it
to you
either.
This whole time,
I
and
don't like
everyone's
it
been taking
either.
care of you, and now you're gonna sit here and refuse to be discharged. What do you want us to do? We did everything we could do.
I want you to treat me.
I treated you. This is an ER.
It's
This is
Dr.
not
Anwar
fix
here.
everything.
Dr.
No,
Anwar.
Dr. Anwar is not here.
Dr. Anwar was on call at the
Well, he's
hospital
not here right now.
this morning.
Well, he's not here now.
So there are tests that I did yesterday that I mentioned to you, the abdominal ultrasound, and I looked at that,
Okay.
and I do have a copy here. I wanted to show you.
Perfect.
Okay.
Bring it.
It's right here. Now, this is the area that was very concerning to me.
Okay.
No, not even that.
Kidneys?
The right kidney.
Okay.
What's
wrong with
hold on,
it?
Hold on. I did take some
I think
notes.
the left kidney.
Left kidney, that's it.
Okay.
But
so
then
cyst.
there is they weren't able to limit. They were limited, I guess is what it's saying, because of because of the window.
So it's not so much.
In
the
addition
window.
to that, the impression said, you know what this is?
Okay.
This is cancer.
No, that's not what the impression says. Okay. Did you go to school or did I go to school for this? Let's get this straight.
I didn't.
Okay,
I
I
did
did,
it.
and
Yeah.
I'm taking care of you like I would take care of someone in my family. But when after you've been here for 4 hours, and when I come in here and you tell me that we didn't do anything for you and that you can't let us do this to you, that makes me upset too.
I did
because
not
sat
say
here-
you did not
just
do anything
said
for
that.
me. I
You
said,
just said that.
I am not going to allow you
And you
to
said
send me
you didn't
home
treat me. Did you just say
feeling
that?
the same way
That's
I
not
felt
what you
when I
said.
walked
That's
in.
not what you said.
That's what I said.
That is not what you said. You said that, and
Yeah.
in addition
You know
to
why?
you didn't treat
That's
me.
why I recorded it, because cameras don't lie.
What
That's
are you
why I recorded it.
recording? You know what, you want to play this game? Let's get
I
some
do not
games.
want to play the game.
No, it's okay. We'll get some.
What? Are you serious? I'd like to talk to your supervisor or your manager or whoever's at.
That's fine.
Yes, that's who I'd like to talk to. Thank you. Calling security on me. Are you serious? This woman has lost her mind. I went to school for this. Are you serious?
Healthcare perspective.
I am trying to talk to you, to explain to you, and you just get upset and you walk out.
That's not true.
And you say you're going to call security.
Yes.
I am a very calm person.
No, you
I
are.
wrote things for you. I wanted to go
And I've
through.
looked at them.
You are just trying to escalate the thing.
Ma'am.
I want to explain to you these things here.
Ma'am,
And
I
then
have
see
looked.
what
But
your
I told you my opinion. This is an emergency room department. This is not a primary care facility.
I understand.
I cannot fix your problem today. I can look for an emergency and rule out any emergency that I could possibly help you with today. I did that today. I walked in here. I listened to your story. I spent time with you, even though we have many other patients. I listened to you. I ordered labs. I did my imaging. I did diagnostic. I ruled out any emergency for you today, which is what the emergency department is for. You do not have a medical emergency that warrants admission into this facility today, ma'am.
I do not.
You do not. No, ma'am, you do not. Not at this point, not from the workup that we did. We're in the middle of a global
What is-
pandemic. You cannot.
What is this part of the body here? Is this the liver or the kidney? The
There's
left
several
kidney?
things there, ma'am.
Yeah.
There's a kidney, there's a spleen, there's
Yeah.
some of your small intestine, there's omentum, there's fatty tissue, there's ribs, there is lung. There are many things in that area.
This side. Is
Yes,
this,
ma'am.
This side? I'm in pain.
Yes,
On
okay.
this side.
Okay.
I'm in pain.
Ma'am, I did the CT scan. There is nothing that warrants admission to the hospital at this time. You do not have anything that is an emergency condition. This is what
I
I'm
do
trying
not.
to tell you. No, ma'am. Not based on it. I understand you're in pain, but I did what I could for you for your pain. I don't want to give you strong medications like
I
opioids.
do not want strong medication.
No,
either.
I know
I
that.
do not.
I know
don't.
that. I
don't
know
want
that.
anything that's going to make things worse.
Exactly.
I do not,
And
yeah.
that's what I told you. I said it'll worsen your constipation, which is what we did see on the CT scan.
What is the problem? Is there a reason why you asked me do I have insurance? I work for Disney.
I asked if you had insurance so I could prescribe you medication that you can actually fill. I am taking care of you like I would my family. No, because you are making
I am
assumptions,
being
and this is not
I-
okay. I have so many other patients I'm trying to take care of. We're in the middle of a global pandemic,
I know
and
that.
you're sitting here to fight with me because I
I
didn't
am
take
not
your pain
fighting
away.
with you. I'm
That
not
is what
fighting
you're
with you.
doing. That is what you're doing.
I am expressing to you
No.
other things that I have here
and I've
that
listened
maybe you
to
are not aware of.
I've listened
before.
to you. I listened. I
But you
evaluated
didn't.
it.
You
I
walked
looked.
out and you said you were going to call security. That's what you said.
No, because after 4.5 hours of you being here and
Mm.
me treating you and me looking at your ultrasound report, I looked at your x-ray, I looked at your past labs, I already reviewed it on the computer, so
Do
I
you
have
have a
been taking care of you.
gastroenterologist here at the hospital that can review those records?
We have gastroenterologists on call, but I don't call them for a case that doesn't warrant an emergency situation.
Maybe because Anwar was here in the morning, and I did see him when I was checking in
Okay.
at the lobby.
Okay.
So if he has left for the day, there has to be another gastroenterologist that can look.
Ma'am, there
and be
probably
able
is,
to-
but there
yeah.
is nothing for them to look at from the ER standpoint. This is an ER.
From the ER standpoint,
Yes, you came in through the emergency room. This is the emergency department. People come here when they're dying, not when they have pain for several months. I don't know what to
I
do.
could be.
I helped
I
you with
could
your
be.
pain. No, you're not. You
I
are not
could-
dying.
I don't know.
Okay,
Do
I'm
you
sorry.
know? I
I
don't
have
know.
other patients to take care of, and I'm trying to help you, but you are sitting
All I
here
wanted
refusing.
was for a gastroenterologist to review
Ma'am,
those two
you
tests
have a
from yesterday.
gastroenterologist. You need to make an appointment and see them outpatient.
If
You can't
have
just come
one
in here and
at the
demand that.
hospital,
You can't come in here and demand that I call your GI to specifically come here to look at your tests. He has very sick people too.
I asked the
upstairs.
nurse.
Yeah.
I asked the nurse.
Okay.
And when you go to speak to the doctor, just tell her, Dr. Anwar was here in the morning. Is he still here? Did he review?
Yeah.
Especially since he's the ordering doctor.
Okay.
And he was the doctor on call.
Yes.
That's all I said.
Okay.
I didn't demand anything. I
Okay.
did not.
But now you are.
But now I am.
Yes, because you're refusing to leave when I'm telling you there is no medical emergency for you to stay.
Okay. So I just have to leave, and you tell me I have possibly a vein problem.
I never told you you had a vein problem, man. I
You
said
said
it.
it's possible.
No, I didn't.
And you said you need
No,
to do
I
an
didn't.
MRI.
Review your tape. If you recorded everything,
No,
review it.
that was
I
earlier.
said nerve. I did not say vein.
That was earlier.
said nerve.
No, okay,
Okay,
nerve.
so
And,
review your tape.
No,
if
no,
you
no. That was
recorded.
earlier
Are
when
you
we were
still
talking
recording?
about. No, that was earlier when we were talking about the discharging.
And
when
you're
we
still
were ta-
recording.
when we
Okay.
were talking about this-
No, if you're gonna record, I already asked you not to do this, and you're
Where-
still recording against our
Where
permission.
is your
Ma'am,
supervisor?
please put your clothes on.
You're gonna have
You're
to leave.
out. Thank
Okay.
you very much.
You cannot record in a hospital.
Why not?
It's against hospital policy. Now, we will say we are recording audio video with VLEC.
Yeah.
It's for our policy,
Yeah.
any call we're called to,
Mm,
but you are being asked to leave at this time, okay?
okay.
Alright, so if you want to...
I don't understand why she's asking me to leave because the same way I came in today for treatment, I am leaving feeling the same way. And she just escalated everything
Alright, well,
when I asked.
at this point for security, you've been discharged, and you do need to go, okay? So we're gonna give you a couple minutes to get dressed, get what you need.
Yeah, and also call the person who's gonna come pick me up. And
Yeah,
they haven't provided me any paperwork
You need
yet.
your discharge paperwork?
Yeah,
Okay.
yeah,
that for you.
yeah.
Alright.
Okay,
So yeah, we'll give you a few minutes.
okay.
Oh, I'm sorry. You
That's-
want to change real quick, or do you want to sign? It's
No,
just the
it's
paperwork.
okay. Yeah.
So it's Dr. Anwar, okay? Unless you
Yeah.
already have a GI. If you don't, or if you do, you don't need to switch. We just want to make sure you have a GI you can follow up with.
Yeah,
Okay?
it's annoying.
All right. Potassium information and something with GI. Oh, it's on the bottom of that. Constipation. Do you have like stool softeners and things like that at home?
I do have that, which I've been using in the area for
So
months.
definitely follow up with him because, or
I
your
have.
GI,
I have,
okay?
yeah, I have, yeah.
Because that's gonna be, the biggest thing for you, all right?
I got
Got a pen?
don't worry. Yeah, I got one. Yeah.
Okay, just sign there, print there, and that's saying you're getting the discharge paperwork, okay?
This is so ridiculous. I cannot believe you guys. Not you. Not you. I mean, I work at Disney. When you guys come to Disney, I want to take great care of you. And when I come here, I want you guys to take care of me. You know? This okay, yeah, that's
Yeah,
me.
top line, yep.
Okay, so
Has Disney given you guys a timeline yet? Do they have any updates?
no. We just have a hotline where all
Gotcha.
cast members are home. So
Yeah, once we heard
We
Disney
don't
was shut
know.
down, we're like, all right, that's a big,
it was.
that's a
I
big
mean,
thing.
so unprecedented. Can you imagine people who have planned? People wait 10 years.
Absolutely.
Oh my gosh, I couldn't. I just the billions of dollars will be refunding. It's crazy. This will be your
Just the date, yeah.
date. It's
Yeah.
26th.
Yes, yep.
Day. 26.
Yeah, it's hard to believe because there's no spring breakers. There's no spring. It's like, how is
Yeah.
this March 26th and nothing is happening? It's so surreal. And that's just for me to sign. That's
Okay,
me to sign.
honest.
All right.
Yeah,
I'm gonna let
I
you get
think I
changed,
got it.
okay? Oh,
Yeah,
that's your
then
pen.
I'll go.
I almost tried to
Yeah.
steal your pen. Sorry.
Thank you.
Oh, well.
My husband's asking where he should come to pick me up. Emergency room.
The ER lobby.
The ER. There's somewhere to sit there.
Yeah, there's a
Okay.
lobby. I'll just follow me and I'll take it.
Can I think I may need a wheelchair.
I don't think I have any right back here at all. Yeah, the transfer was looking for one too. It's just right down the hall. Just take your time, okay?
Yeah, like if you have like a golf cart.
No, it's like literally right here. We'll let you sit right out here.
Oh, okay. I
Yeah.
see what you're saying. Okay.
No, the lobby's right there. Yep. Sit there until he gets here. So she's going to be sitting in a lot of weight on her.
They couldn't even offer me a wheelchair. Help. Leaving the hospital, they actually kicked me out of the emergency room. Donnie's here to pick me up, so I'm gonna see if I can make it working outside.
No, that's fine. Yeah, okay.
He's here, yeah. Yeah, thank you, Nick. Oh my God. Oh my God. You didn't even open the door for me.
In terms of the checks that you may be receiving.
Oh my gosh.
You are single.
Oh,
Do they give you anything for the pain?
no.
What good are they for? Besides the big ass bill.
If you
Oh
make
my
$80,000 individual, $50 check, hopefully within the next 3 weeks, the Treasury Secretary.
That didn't help, huh?
No, no.
$90K, I get a $200 check. If you make over
Hey, baby.
$90,000,
You're not better at all. You look actually puffier than when you went in.
Yeah.
Salary.
Did they give you what they give you besides potassium?
All right, let's go back to the phone.
Nothing. Potassium. It is, yes.
Hi, this is Linda at Dr. Anwar's office. I got a message to give you a call.
Do not go to Osceola Regional. Dr. Anwar is
They
going.
stopped letting us do procedures all over both hospitals. Yes, we're not allowed to do any outpatient procedures right now.
Oh, is that what's happening?
Yes, because of the COVID virus, they are limiting surgeries and endoscopies that unless they're life-threatening emergencies. So we're not allowed to do any elective procedures right now.
But it is life-threatening for me.
Well, if you feel that it's that bad, the only thing that I can tell you to do right now is go to the emergency room because they're letting us do procedures, emergent procedures, if you're admitted to the hospital, but we can't do it as an outpatient. So if you're having a lot of pain and you feel like this is a life-threatening emergency, you're going to have to go to the ER, okay? And Dr. Anwar is here at Celebration. That's the only ER he's going to be able to go to.
I'm in so much pain. Let me have my husband explain. I don't even know what to do.
Let me understand. If she's in an emergency and needs the Dr. Anwar to check her out, she has to do what?
She has to go to the ER at Celebration because our office isn't open and they're not going to let us do any outpatient procedures or evaluations right now. So if she's in that much pain, I'll bring her to the ER at Celebration. We're here at the hospital right now.
Right. We were at the ER yesterday, and she was in so much pain, and she begged them to consult Dr. Anwar on the tests, and they called security and told her to get out of the hospital.
Yeah. Yeah, I would go back again. I mean, if she's still having that much pain, just tell her to go again. Tell her that you spoke to us. You spoke to Dr. Anwar's nurse practitioner, and I told you to go to the ER.
Well,
And then
actually,
they will call
Emma,
Dr. Anwar before they let her go if they do think that she needs to be admitted.
Just to let you know, she literally had seen Dr. Anwar at the hospital, and that's why she went. And he said he was on call today, and that's why she went to the emergency room.
Right. And we are on call today. It's just that you have to go through the ER physicians first. And that's really all we can do. This is the only place that we're able to treat anybody right now is the hospital. They're not letting us do any outpatient type of stuff right now. So unfortunately, that's the only advice I can give you is go back to the ER. Just tell them that you spoke to me and she's in so much pain that we wanted her evaluated again. And tell them to call Dr. Anwar when she gets here.
Because, well, here's the problem. She's going to probably run into the same ER doctor that called security and was going to trespass her because they would not. She spent literally 2 hours after begging her to please call for a consult from Dr. Anwar because the tests that he already did call in were back, and we kind of actually knew for a fact that you were going to say this. This is kind of just us verifying that we knew they would say, well, you have to go through the emergency room, which we already knew. That's why we told this woman over and over and over again. Now, if we go back, she's probably going to trespass us, and not to mention, we can't afford $20,000 a visit in order to go to an emergency room person that's just going to kick us out of the hospital.
Literally all I can do. Our hands are completely tied, and we can't do any tests, and our office isn't open, so we're not in the office, we're in the hospital. So if you want Dr. Anwar to evaluate her, that's going to be the only thing that we're going to be able to do right now.
So the emergency room at Celebration, is he on call today?
He is. Yes, we've been on call all week.
Yeah, that's what we knew. All right, so, and he was on call yesterday too, right?
We've been on call since Monday. Yes, and we're on call through Sunday evening. Actually, Monday morning at 7 a.m.
All right. Well, that was everything we knew when we begged. We begged them to call and consult them, and she refused to do it.
Just tell them that you already talked to us, and Dr. Anwar's standing right next to me. I mean, just tell her that whoever admits to the ER, just tell them that we need to talk to him. Okay.
I don't know. I don't know if we can do it again. It was psychologically really bad. I don't even know if she can. It was very traumatizing.
I'm sure. Yeah, the only other thing that Dr. Anwar can't go to any other ER, but you can try a different ER if you want just to get her evaluated by somebody.
Well, we don't want to just randomly go because they're just like you said. What they're doing now is they're all saying global pandemic as they're all sitting around talking to each other because there's nobody in the hospital. So nobody's doing anything, and they literally called 3 security guards. She couldn't walk, and they wouldn't get her a wheelchair and walk her out the door. That's how bad it was.
Yeah, well, it sounds like she's in really bad pain right now.
She is in bad pain.
Because I don't want anything to happen to her either. So just tell her.
She is in bad pain, but going to the hospital is no guarantee that they're going to contact you. That's my problem. There's no guarantee that they won't arrest her for trespassing. You don't understand how bad it got yesterday. We were begging the doctor. She was begging them. I got it all on tape, actually, begging them, and they forced her out of the hospital. They got 3 security guards and walked her out without a wheelchair, and she was begging for a wheelchair, and they said, we don't have any wheelchairs available at Celebration.
Yeah, that's it. Let me try doing this. Let me call down to the triage desk over at the ER and just tell them that we talked to you and her on the phone and that we wanted her to come in and to give Dr. Anwar a call.